We're going to bring this special meeting to order right now for Yuma Elementary School District Number 1. If we can all rise for the Pledge of Allegiance and a moment of silence. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, and if you can all be seated. I'm just going to read our little blurb that we have. Due to the health situation with COVID-19, Yuma School District 1 will hold this special meeting virtually via YouTube Live. The public is invited to view virtually on our YouTube page, Yuma School District 1, and our Facebook page. We will now go to item 1.2, which is the adoption of the agenda. I need a motion.
So moved.
It's been moved by Karen and seconded by
I second.
by Adele for to approve the adoption of the agenda. All those in favor say aye.
Aye.
All those opposed? Motion passed unanimously. We will now go on to item 2, which is information item, where the district staff and school principals will present information regarding COVID-19, the district's instructional program, and possible paths forward for in-person instruction. Mr. Sheldon?
Yes, Madam President, members of the board, first of all, thank you for coming today on for the special meeting. We have some very important information to offer you today and for your consideration. And so today we're going to present a good deal of information about where we have been and what our current circumstances are relative to our instruction model with COVID-19. And then we'll have an opportunity for some questions and some discussion. And at the end, the option to make a decision about returning to school. And while I'm at it, if it starts going on a little long and you need a stretch break, just kind of give me the high sign. We can recess, take a little stretch break and come back. I just wanted to mention that to begin with. So I gave you a little, just a kind of an outline agenda of the topics that we're going to discuss during the presentation portion, the information item. And we're going to start with Dr. Alka. She is going to go through a little bit about who we are and where we have been. Dr. Alka?
Thank you. Good afternoon, everyone. Thank you. I just want to spend a little bit of time reviewing who we are as a district. Our mission is one community pursuing excellence. These are our 4 areas that we really feel are critical in our organization: personalizing effective instruction, building strong collaborative structures, supporting the whole child, fostering safe and innovative culture. When we began to plan for the 2021 school year, we looked at some core values that we wanted to ensure were part of our decision-making process moving forward. And there were 3 that we really focused on, and so I just wanted to share those quickly: health and wellness, equitable and excellent student learning, safe schools and operations. And I do want to just quickly read the sentence following in each of those. So for health and wellness, we care for the whole child through providing for the physical and social emotional well-being of each student and employee of District 1. For equitable and excellent student learning, we support and encourage the learning of every student through mastery of essential, meaningful content and personalization. And safe schools and operations, we design systems and operations to ensure a safe, learning environment that is supported by the most recent and comprehensive knowledge from experts in the field. So a little bit about our teaching and learning timeline for the school year 2021. Just a reminder of where we have been. On August 17th, 2020, that was our first day of school. We did open our schools for students who needed a safe place to learn up to 5 days a week, and that is what we call our monitored on-site learning services, or MORLS. You'll hear us talking a little bit about MORLS throughout this presentation, so that's what it is. Most students began the year in remote learning due to COVID-19. On October 1st, we began in-person instruction with our 2-day hybrid model. In this model, there were 2 cohorts of students who were in person, and then also there were students whose parents chose to keep them learning remotely. So cohort A attended school on Monday and Tuesday, cohort B attended school on Thursday and Friday, and then Wednesday was a remote learning day for all students. Again, MORLS students were able to be at school 5 days during the week, learning remotely as well. And then on November 30th, we returned to remote learning due to the rise in numbers of COVID-19 and based on the Arizona Department of Health Services benchmarks. And then, of course, we still have the option of the on-site learning services, or MORLS, students remaining for those students that needed that option. And we are still in this remote learning process at this time. We have had 3 models that we have looked at over the last year, traditional, hybrid, and remote. Traditional being a model in which students would be in school in a traditional way with standard operating procedures. This would be a situation in which we would have very little or no danger of COVID-19 spread happening in the community. Hybrid is a situation in which students are both in person at school, and also there are students that are learning remotely. That's where the hybrid model comes into being. So we have students in both areas at the same time. And then fully remote, where students remain learning remotely, whether they are either at school or at home. Just a little bit of information regarding our monitored on-site learning services, our MORLS students. So several of our elementary schools have between 123 and 295 students attending MORLS 5 days a week. And those students have been in attendance for the majority of this school year every day, based on the need that their families have. Additionally, just for information, classrooms at these campuses have up to 15, 18, perhaps even 20 students in some of their classrooms. And they have maintained these numbers even during the worst days of our pandemic that we're in the middle of, which was in January of 2021. We do not have confirmed evidence of spreading or contracting COVID-19 on these campuses. These are just a few pictures of some of these campuses that have a large number of students that are attending MORLS and are in classrooms. The next.
Okay, go ahead. Thanks, Dr. Alka, for that trip down memory lane. So we'd like to move forward to some information from our operations side. We put transportation first because Ron is going to finish with us, and then he's going to give the same presentation to the high school district moments later. So Ron, are you there?
I am here and ready.
All right, everybody, Ron Sheepers, our Director of Transportation. And Ron, please go ahead.
Yes, thank you. So just the brief outline that we're looking at the slide there, that we are going to be short driving staff to transport students 5 day a week to school for a number of reasons. And we've got drivers and staff that chose not to come back because of coronavirus and those kind of things. But it was kind of difficult to get people on board here the first part of the year because we didn't have a lot of applicants, even though we were advertising and trying our best to get them. And then the ones that we did have, the training process and testing process was really lengthened because the Department of Licensing and Department of Public Safety were, canceling. We had, months out appointments that we usually could get done in a couple of days. So, we really kind of are depleted in our driving staff. That has picked up here in January, where we have had some additional applications come in. We've got 11 people training process now, and some of the restrictions of getting things done timely has kind of gotten a whole lot better too. So we are in the process of getting our driving staff, at a better state. But in order to go back to 5 days right now, we are going to be short drivers where we might need to double runs or not be as considerate as we were in the past with any kind of distancing on the bus and combining some bus routes together and those kind of things in order to keep the buses running instead of having to cancel bus runs. So most of what we see there still follows the same protocols that we were following in our guidelines that we had when we were doing remote learning or hybrid, I guess I would say, with our busing. It's just that we are really not going to be able to focus anything on distancing as one of the bigger things. And the fact that there might be that possibility that bus runs need to get canceled is kind of right there on the horizon too. So the other recommendation that I would have is that we maintain the current bell schedule of 9:40 to 3:40, because that does give us some additional time in between our high school bus runs and our elementary bus runs, that when we do have to double run, it gives us more of an opportunity to do that without students be excessively late to school or having to wait an excessive amount of time after school. So any questions you guys have about transportation?
Ron, will the buses be clean between our district and the high school district?
Yes, we'll continue our cleaning and disinfecting protocols with wiping down the high touch areas in between student groups and having additional time during the day for bus cleaning, and all the buses will be disinfected with that electrostatic spray as we've been doing it every evening.
Thank you.
Ron, what is the time frame for a bus driver to be fully trained?
Oh, if I was to say on a regular basis, it takes 3 to 3.5 weeks to actually get somebody in, get their credentials, and get them trained so they're licensed to be able to drive. That's a normal time frame. We've had one driver that came and we started training him in May, and he just got his DPS numbers last week.
Oh my gosh. But is that process is improving? Is that what I did hear you say that?
Yes, the process is improving. We are narrowing that down to probably, I'm going to say, month and a half or so instead of 6 months.
Okay, thank you. And
Ron, did you say we have 11 drivers currently being trained? Was that this meeting or was that last meeting an hour ago?
Same number, same meeting, information, yes. And I'll be sharing that with the high school district here in about a half hour. So,
Ron, I have a question. How many more drivers do you need to be fully staffed?
oh, we are probably 30 some drivers short of being fully staffed.
Okay.
One thing I would add regarding transportation, maybe many of you saw the high school district put out a survey about returning to school, and part of the survey had to do with people who live outside the transportation boundary and whether or not they would be able to provide their own transportation in the event that we were short on busing. And just heard this afternoon in our YEC meeting from Mrs. Thompson that very few of the people in the high school district who live outside the transportation boundary were able to provide their own transportation. So she was a little bit surprised at the high percentage of folks who live outside that 2-mile radius for the high school district. It'd be 1.5 miles for us, who really don't have the necessary transportation to make sure that their student can get to school every day and back. So that's, transportation we learn, and then every now and then it really comes up very strongly as a big equity piece for kids to be able to get to school. Any more questions for Ron?
I don't think so.
Thanks, Ron.
Thanks,
All
Ron.
right, thank you.
Jamie, clarification, with regards to the statement you just met with regards to the students being, beyond the 2 miles. Is that because of the school they elect to go to, or it's just,
No,
it's beyond?
the high school district has the same policy around open enrollment as we do. If they choose a school that's not in their attendance area, then they have to provide their own transportation.
Okay, I just wanted to clarify
And if
that.
they live more than 2 miles from, if they attend their school in their attendance area and they live more than 2 miles from the school, they qualify for transportation services.
Right.
In our district, that's 1.5 miles, and we also make some concessions for students in our elementary schools who would have to cross a major traffic thoroughfare.
Okay, thank you. Thank you for that clarification.
Jamie, I should have maybe asked this with Ron, but the 30 drivers, that's what we need to get a bus on the road, but don't we also have bus monitors? Are we?
Yes, the fully staffed, to be fully staffed, we have more drivers than we have routes. So being fully staffed means we have enough drivers to execute all of our routes and some extra drivers, because when you're talking about 200, over 100 drivers, 130 drivers, invariably a handful of them are going to be out any given day. There are also other people who are certified to drive bus, who maybe they're mechanics, maybe they work in the office or whatever, and they pitch in on an emergency basis. But generally, to be fully staffed, I've heard Ron report before that he likes to have an additional 20 drivers.
Okay.
That would also encompass any of the athletic events for the away games this is pre-COVID.
For high school,
For
yes.
high school.
Yes, and I understand that they've put out, and to see if there are drivers out there who would want to just do the trips, which could help, that could help also. And there are drivers who like to do that. They like to take those out-of-town trips with the teams and come back, so.
So when he says 30 drivers short, that's 30 drivers. That's not his ideal, like you said, the extra 20. So does he have the extra 20 or?
No, not right now.
Okay.
And, we have 11 in the chute right now. We're taking applications all the time. Maybe you've seen the big banners around town.
Yes.
Be a bus driver.
Right.
So
So actually, we're
Yeah.
more than 30 drivers.
once those 11 are in, then we'd be looking at, 19. So it's a matter of, how many students are, when it's time to come back to school, how many students are going to elect to stay at home? How many students are going to elect to come to school? Of those students who elect to come to school, how many of them are going to be outside the transportation boundary? And then from that point up, then Ron's staff can determine how many routes he needs to run in order to get kids to school. So right now, he knows he's short to transport everyone.
Okay.
Um,
If it were 5 days a week.
Yeah, right, if it were everyone 5 days a week. So what we'll have to do is when we make a decision during that time period period running up to school starting in person, then his folks will need to know who's coming back and whether they need transportation.
Okay.
From that point, then he'd need to know, he would be able to determine how many routes are needed and how many drivers are needed.
So Mr. Sheldon, they might adjust routes based on the numbers
Yes.
of students and their locations?
It could be that maybe there are 2 routes that are geographically close that normally would be 2 different routes, but there's only maybe 10 kids who are actually going to attend in person on one route and maybe 15 on another. They'd be able to put those 2 routes together on a bus. And in worst case scenario, they might have to take a double run, where they take one group of kids, come back and pick up another group of kids and take them, and they might be a few minutes late to school. And that's until they can get enough drivers on board. Mhm. Okay, next is our facilities. Mr. Frank Evanson. Frank, are you there?
Yeah, yes, sir. I am here.
Alrighty. Frank oversees our facilities and maintenance. That's a lot of
Good
square
evening.
feet, about 1 million square feet.
That sounds a lot worse than 18 schools, I have to say, when you put it that way. Well, good evening, everybody. How is everybody? Hope everybody's heart's beating okay and everything. This first slide is actually it's pretty much the same one that we showed back in July, with maybe some wording differences, because at that time we were still in the process of acquiring some of that information, and we were in the process of doing some of it. Now it's kind of a situation where we're already doing it now, and we just continue to do it. And we have the tools that we were waiting for then. We have them in place now, and we're using them. So some of the wording is different, but it's basically the same slideshow that we did before. It shows a classroom that is social distance. It shows examples of what we consider to be high-touch areas. It shows a chemical station where the custodians get their chemicals in order to use to sanitize, disinfect, and clean classrooms. It's also the same materials that teachers would use. And then there's an exploded view of the actual chemical that we use currently. And then it also shows a picture, and if I'm not mistaken, there's a link to the electrostatic sprayer if you so choose to go and spend some time reading up on it. But that's basically what that first slide is. And if you have any questions on it, I'd be more than happy to answer them. But it's real quick. It's real, it's just kind of a basic thing of what's happening. It's not everything that's happening, obviously, but it gives you an idea of what, some of the things that we're looking for. There's still, there's also light switches and, the desks themselves that we hit. The sides, not only the door handle, but the sides of the doors. Drinking fountains, on the ones that we're actually using, the filtered ones that we're actually operating, cafeteria tables, etc. Does anybody have any questions about this stuff right here?
Frank, I don't believe in the earlier presentation, I don't believe we had started the door hanger process yet. Can you explain that quickly, please?
Correct. Yeah, that's in my next little piece here. But yes, what it is it's actually a 2-sided hanger, and it basically says it's green or it's stop. Green means that the classroom or area has been disinfected, and that you can go in there and do your work and your operation that you would normally do. If the door hanger happens to be red, that means it hasn't been, or perhaps somebody's inside right now doing that. This was a two-folded kind of a situation. We wanted to let people know, and mostly for our teaching staff to know that that our custodian had been in there and that they had sanitized and disinfected their area for them. But it also worked for an after-hours situation if a teacher, which, and as we all know, teachers don't work a normal 8 to 5 schedule. They work, I don't even know what it is. They're there all the time. Every time I go by school, there's a teacher there. So they don't work a normal schedule. So sometimes they have to come in after hours. Sometimes they have to come in on the weekends. And so what would happen is, if in this situation, if we're sanitizing a room on a Friday, and teacher Jill or teacher Bob were to come in over the weekend and and work and do their thing, The room could possibly not be sanitized again for Monday. And when we started school, we'd have a disinfected or a contaminated, I don't want to make it sound like an alarmist, but a contaminated room. So what we did was we wanted the door hangers to work for both our custodial staff and the teaching staff. So when a teacher goes in there or whomever, principal, teacher, para, they can go in there, work in their area that they're working in, sanitize that area with the chemicals that are provided by the district, and then they can go and put that door hanger back up in a green position, knowing that, or notifying the next person who come to that room that the room has been sanitized and cleaned. You've probably seen them around the district and probably wondered what they were for.
So I could just add, I think the important piece of this is that when a teacher enters their classroom or an employee enters their work area and that green placard is hanging from their door, they know that their room has been sanitized.
Okay. Well, the rest of the information that I'm providing here is basically it's a two-phase type of thing. It's the cleaning routines and then the indoor air quality and the steps that we're trying to take to help with that. Our cleaning routines have kind of evolved as it has gone. When we initially started, we didn't have all the tools that we have now, and now we have all the tools. The tools being the electrostatic sprayer mainly. The electrostatic sprayer allows us to clean larger areas in a quicker amount of time, and it's very efficient. It's kind of a high-tech type of thing. We're not the only ones using it. Obviously, I believe you heard Ron mention it. They're using it out of transportation as well. Other districts are using them. It took us a long time to get them, and they're very pricey. One of the things that we ran into, though, and you run, this happens sometimes whenever you start something new, is that we ran into some glitches in where we had to increase or change the personal protective equipment that we were using for them. So instead of just a custodian going in there and just kind of spraying it willy-nilly, which is kind of the way they did with their other chemicals, we found that there were some, this was a little bit harsher material than what we were using before. So we provided them with a face shield, goggles, the masks which they were already mandated to wear, and an industrial rubber glove that they can reuse instead of it being just a disposable glove, which has obviously more protection. We've done those things. We also instituted, as I mentioned before, the door hangers. It's important to say that the whole goal of everything that we do, whether it's the electrostatic sprayer, the old way that we were doing it, or just simply wiping down a countertop, is that we're trying to do our best to provide a clean, safe, and comfortable learning environment for our students and staff. That will change from time to time. The more kids that we get in there, the more difficult that will be. But that's what we want. We want our kids back. So we will do whatever is needed. If we need to make some more changes and tweaks to this, we will. Most of the, I would say, most of the principals at all schools have had already, made the changes that they need to make in order for the schedules and timing and stuff to work, with really little assistance really needed as far as that goes from my team. Then basically the only thing that we've really provided, it was training on the equipment and the equipment itself. It's been, as far as I can tell anyways, a really good, seamless working in a relationship with the two, the maintenance department and the principals. Of course, it could be better, I'm sure, and they would probably say the same, but as we go, we learn and we get better, and we will continue to get better. And it's also important to say that and note that everything that we have done up to this point are right along the lines with what other districts are doing, or for the most part, what districts are doing and what CDC recommends. We've, as a district, not only in this realm, but pretty much in every step of the way, excuse me, we've kind of followed their lead in that freeway to where we're going. So nothing that we're doing is like out of the ordinary. You wouldn't go, into one of our classrooms and see something strange if you went to another classroom somewhere else. And before I go to the indoor air quality, if you have any questions about cleaning, please, by all means, shoot.
I have a comment. First of all, Frank, thank you to you and your staff for your hard work,
because safe
Sure.
schools, number one, can't get our kids back to school if the classrooms aren't safe. Now that you've got the equipment that you need, are you developing routines so that you can continue to stay on top of your preventative maintenance, all the other things that you would normally do on top of this?
Well, this kind of became part of our preventative maintenance for especially for our custodial staff. And the short answer to your question is, of course, yes. We've had to make tweaks to our daily routines, as I had mentioned before. Some of the custodial staff schedules isn't what it was. It wasn't a simple morning and then afternoon. Now it's kind of sometimes there's like a hybrid where they'll have a person in the middle, or they have them all during the daytime. It kind of depends. And as we start to bring more kids back, that will change as well. As far as maintenance goes, there was a lot of things that we had to do that weren't there in place. For example, all the plexiglass you go around the district and you see, we had to install all of that. That wasn't there. So a lot of our vacuum cleaner repair and air conditioning repair and things of that nature had to get tweaked, pushed around, and rescheduled so that we could get these things in, so that we could have safe places for our child nutrition people to serve meals, and for our office staff at our schools to receive the public when they came in. So the short answer to your question is yes, and the long answer is we're still working on it, and we're going to continue to work on it.
Thank you.
We also have been able to leverage our crossing guards. There's not as many kids to cross now, so they're employed as a 4-hour daily employee, so we've been able to
Great.
have them come in and help out.
Good idea. Mm-hmm.
Frank, do we have enough equipment, enough of the electrostatic sprayers? Or does your wish list contain more?
More would be nicer. There is another style and vendor that has one that is less expensive than this one that we're looking at. This will entail changing our chemical provider, our custodial supply provider, which we are also looking at. But it might be a more cost effective. It would do the same thing. It's just a different machine.
Or we can have more of them in the field per se.
Correct. Every school has at least one. Every school has at least one, and the larger schools have 2.
Ideally, based on your expertise, what would the ideal situation be for each school?
It would be nice in a perfect world to have every custodial staff member had one, and then the crossing guard that was there to help and could borrow one if they so needed.
Okay, thank you.
Frank, one other question. You mentioned they were quite pricey. Can you give us a cost estimate, please?
I believe they were over $3,000 a piece.
Elizabeth said they were like $3,200.
Yes, they're not cheap. They were not cheap.
Okay, thank you.
You're welcome.
Just for the public to know.
Was that all the questions on the cleaning part?
I think so.
Okay. So on the indoor air quality, this is actually an ongoing process. The first and most important thing that we've done at this point is we've gone around and opened up all of the what we call fresh air dampers on all the HVAC units that have. Not all of them have them. Some of them are automated. Some of them are not. And what that actually means is actually the technician actually walks up to the unit, and it's basically an extra duct on an air conditioning unit that vents to the outside. And there's a little pin. They pull the pin, they open it up to whatever the desired level, and then they pin it open. And then every time the unit comes on, when the fan is running, it actually brings in a certain percentage outside, quote unquote, fresh air. They call them economizers or fresh air dampers. This is like the universally accepted method of bringing in the easiest and most efficient way of bringing in fresh air to an area. It really, in our case, it didn't really cost us any money. At this point, it was just a matter of our technicians going around and doing it. And part of the glitch here in Yuma, and maybe and probably in Phoenix and some other areas, is when you bring in air from outside, it gets hot, and we're going to experience some of that here shortly. That's going to have to be a deal where it's going to have to be a compromise, a give and take with school staff and us and the district administration on how we go about doing that, because we have to have the fresh air, but we also don't want to overwork the HVAC unit, and we also don't want to overwork the staff member that's in that area that's now warmer than they usually are because we're bringing in all this fresh air. But that's the first thing that we've done, the easiest and honestly the most widely accepted thing that we've done. We have also researched and reached out to a couple of vendors who are experts in the field of indoor air quality upgrades and systems that you can use to not only maybe automate our fresh air systems that we have now so they're not all mechanical, add the economizer to a system that perhaps doesn't have one, and also perhaps other implementations such as ionization systems, changing our air filters to a higher filter rating, like a MERV 13. I think currently we use MERV 8. The higher the number, the higher the efficiency, the more particles they grab. The potentially standalone HEPA air filtration systems that would actually be in the corner of a room or somewhere located in a room that would actually be filtering the air as while the folks were in the room. It would be something that you could turn off and on. So when the class was out of class or at the end of the day, it could be turned off. It's an actual filter. It's a machine that actually filters the air. Also UV lamps, either actual UV trofer lamp style lamps, like a fluorescent light you would see in a normal room, but it would have UV lamps inside of it to help. But they use radiation basically to kill viruses, to lack of a better way of explaining it. And then also there's a style of UV lamp that you can actually install in an HVAC unit, which does the same thing. It just does it inside the unit. And we've also reached out to which we're going to meet with next week, a mechanical engineer, to make sure that we're going to create a scope of work that is what the district needs, not what a salesperson from a certain vendor may try to sell us. It's what the district needs to be the most efficient, cost-effective way to keep our classrooms safe, our staff and students safe while they're in our classrooms and in our schools, and put the most bang for our buck where it needs to go. And we're gonna maybe entertain the idea of maybe working with this mechanical engineer in such a way as like a consultation type of situation. And it's also important to mention that all the ideas that we've came up with and ideas that we've been presented are industry standard, ASHRAE rated, and those are all little initials that basically are the top of the line and the standard that are used for clean air and economy and efficiency in commercial settings.
So regarding the air quality, Frank, what would you like to see optimum for the district to use?
Well, I'm going to be honest here because that's the only way that I know how to speak.
That's fine.
No, for me, and if I was a teacher and I was unsure or convinced basically that the district had done certain things. Let's say, for example, we did the UV lamps, and they're inside the HVAC unit. Well, if I'm the teacher, I can't see inside the HVAC unit. I don't know if there's a UV lamp in my classroom. I have to trust the district's word that they did put them. But if it was me, I would feel so much more comfortable with a HEPA filter sitting over in the corner of my room filtering the air while we were in there breathing it. Personally, that's my personal opinion. We have not received pricing on what that would cost versus a UV lamp or ionization or some of the other, the other ideas. The filter change, I'm still waiting to hear back from our filter provider, what that would take to change over from an 8 to a 13. It could be costly. I'm not really sure yet. But that's an easy one too, potentially. That's just a matter of buying a heavier duty filter. And that would, again, that wouldn't really make a teacher feel better, but it would, as the facility director, it would make me feel better because I know we were doing the best we could do as far as the filtration goes. But I know if I was a teacher, which I am not, I would sure like to see that HEPA filter sitting over in the corner. That's me on the soapbox, being as honest as I can be.
Is that a filter that would be mounted, or would it be a portable?
The filtration system, it would actually be portable.
In each room, it would be portable.
It could be, and it could be moved around. Let's say if for some reason you weren't using the classroom on this day and you needed to move it to an office because a counselor needed to use an office or something, you could actually roll it down the hallway and plug it in. They just plug into the wall.
Okay.
Frank, are they both equally effective?
That's what we're consulting the mechanical engineer to see what would be the most bang for our buck. I was reading a little bit earlier today before the meeting about the UV lamps, and it didn't sound too great to me, the UV lamps. Ionization is basically that's science. You know, it's basically removing a neutron or an atom, right? And I don't remember the exact wording of it. You know, electron. But basically it bonds it and it grabs it and makes it, you know, you basically make you grab the particles out of the air, basically. I mean, if that's the layman way of explaining it. And a filter would kind of do the same thing. A MERV filter would do the same thing. A higher MERV filter would do something of the same thing, only it would maybe go down to the you know, to that level, that deep of a level. But anything that we do is going to help. You know, we did the most universally accepted thing already. But you know, going forward, that's not enough. It's my understanding that technically the coronavirus isn't going away. It's just we're finding ways to deal with it, and these are options and ways that we're going to have to find a way to deal with it. And we're not the only district that's dealing with that, obviously. But you know, I only care about Yuma School District 1. I don't really care about anybody else.
Frank, how do we know? How are we measuring air quality now or after these measures are taken?
Well, right now we don't have a way of measuring it. There's no way for us to measure that. All we can do is the best that we can do with what we have right now. If we got into a situation and a deal with one of these air quality control companies, they have ways of measuring it and ways that they can continue to monitor it. That's where it's going to get. That's where we need the expertise also again of our consultation, because we don't want to get into a situation where we're 10 years down the road, we're in a bad deal with somebody and they're not upgrading or providing you know, newer equipment for us that's going to keep us ahead of the virus. Instead of the virus punching us, we get to punch the virus back. So we don't want to. I mean, for me, anyways, I don't want to get into a situation where we're stuck with this old stuff, and you know, it's not changing with the virus, which is what we would need. But right now, in all honesty, right now we have no way of monitoring it. We're just bringing in right now, especially in this temperature and the weather that we're in right now. We're bringing as much as we can.
And I'm curious about if we can access the lower cost alternatives and improve our air quality. That would be a great place to start, rather investing in a huge company that they promise to take care of our air for us, and like you said, it doesn't pan out, or it doesn't have a long-term effectiveness. But if we could measure the effectiveness of the lower cost measures, maybe those things would be enough to get our kids back in.
Correct. Absolutely. That is a much better way to put it than I put it. Exactly. That would be the hope that our mechanical engineer consultation idea hopefully will work, that he will be able to kind of guide us into, you know, systems and things that will actually work for us in our particular application, and ways that we can in the future either, you know, maintain it, increase it, or you know, change it as it needs to be changed.
We have been in contact with another district that installed the ionization in what they call high traffic areas, so hallways and offices. And that installation in their units came to about $1 million. To do a process like that in every classroom would be in the several million. So, you know, that would be the gold platinum standard, but it would be
Quite pricey.
very, very expensive. And like Frank said, for right now, we're bringing in a lot of fresh air. And if we can get something, if we can get a solution in place when it gets hot, which in the springtime is, the last month or so of school, to be able to close down those dampers a little bit so the AC doesn't have to work all that hard,
Right.
then that would be the best scenario. Thank you, Frank.
Thank you.
Frank.
Thank you, Frank.
You're welcome.
Okay, our next section is health services. So we have lots of good information here. Luciano Munoz and Kim Sweeney. You remember Kim Sweeney is our district nurse coordinator. So I'm gonna turn it over to them. I believe they're gonna commandeer the screen, and they have their own presentation.
All right, good evening. Can you all hear me?
Yes.
Yes.
Good evening.
Let me share my screen. All right, so first we want to give a huge shout out to the health services team. And everybody has their clappers. Can't go over this. They have done a remarkable job going above and beyond this year. So I just want to say thank you so much for everything you guys are doing. Kim, anything you want to add to that?
They're amazing. They have been well trained, something that they never envisioned ever having to do, and I've been so proud of them. We have especially 3 schools that we have drive-through testing, Castle Dome with Cassandra Orduro. We have, let's see here, sorry. We have the main school with Vanessa Perez, and then we have Pecan Grove for our students to have drive-through testing, who is Jessica Guru. And they have not only been doing their schools, but they are also doing above and beyond outside testing. So they have been really amazing.
And I also want to give a shout out to Kim Sweeney. She's been so instrumental in this whole process. Typically to set up, testing in a school district, it takes between 3 to 6 months. And Kim and I were able to do this with her team within 3 weeks. So shout out to Kim Sweeney. She's an amazing person to have. So thank you, Kim.
Thank you.
So we're going to start talking about COVID rapid testing in our district and who we are testing right now at the moment. And we've been testing since January 12th. So we have some data to share with you as well. Kim?
Okay, we started this process right after Christmas. We had talked to the public health department. They did a wonderful job helping to show us how to do these things. Right from the get-go, when school did start and we had this introduction to COVID, Luciano and I decided to do 2 things. He managed the staff, I managed the students, because there's a lot of reporting. Between the 2 of us, we're working off of 5 Google Forms, and every test that we do, we have to report to the state. So the number 1 rule was they have to be symptomatic. Now we're talking about employees, and they may be close contacts. They're under the jurisdiction of that they're essential personnel, so we can contact them and get them out of quarantine if it's 3 days or more.
All right, so we want to show you what the process looks like for the employee testing. And so Christine McCoy did a phenomenal job putting the video together that we shared with all of our staff, so the employees are aware of the process. So high five, Christine. Thank you so much.
Yes, thank you.
That video with you.
Hi, I'm Kim Sweeney, registered nurse and the health service coordinator for Yuma District 1. I'm excited to announce that staff can now receive a rapid COVID-19 test on site at our main cafeteria and at Castle Dome Middle School. In December and January, the health service team received valuable training by the Yuma County Health Service staff, enabling my team to safely and effectively administer rapid COVID-19 testing with results available in 15 minutes. If you develop symptoms of COVID-19 or it has been 3 to 5 days since you were informed that you are close contact, you are eligible to receive this rapid test. Rapid testing for employees is available Monday through Friday, 8:30 to 3:30 by appointment only. At your appointment time, simply drive up to the main cafeteria or Castle Dome Middle School and remain in your vehicle. A member of the health services team will greet you at your vehicle. Please continue to wear your mask and lower it to receive a non-invasive nasal swab. You will then be directed to await your test results. If your result is negative, you may return to work when symptoms subside. If you receive a positive test result for COVID-19, do not return to work and contact your supervisor for further directions. Please wash your hands. Please wear your mask at all times if you can. Walk apart 6 feet distancing, and when you are sick or ill, stay home. I would really like to thank the Yuma County Health Department because they have really helped us to make this happen for our staff. They have been amazing with helping with the training and the supplies and giving us valuable information of how we can make this program the best that it can be.
So as the video indicated, there's two drive-through testing locations that we have at Capitol Dome and Post. And since January 12th, we've tested 97 employees already. And out of those 97, we determined 12 that were positive. So it's been very effective so far. Kim, do you want to give a little rationale as to why we decided to have the drive-up testing locations as opposed to testing at the work site?
What we decided was that we wanted to provide 2 sites, one on the east side and one on the west side, to divide the amount of, we didn't know how many numbers to expect that needed to be tested. It has worked very well. It gives me the ability to really watch and answer questions. If I see tests that kind of are like, okay, we need to let them stay home for a couple more days and get retested, I can give them a call. The 2 sites can give me a call. And so we have this dialogue, and we just make sure that they are okay to go back to work so there's no further spread. And this system has worked very, very well.
And it's just been a great resource for employees. Back in the fall, when we were inundated with positive cases, we had employees that sometimes wouldn't have results or their testing for 2 weeks, which was very disruptive to their work schedule, disruptive to them not knowing if they had COVID or not. So having this available for employees now has been a huge relief, and we've had some very positive feedback come back to Kim and myself and principals. So we're grateful for the opportunity to have this in our district. We also want to show you the process with the student testing. So again, Christine McCoy did a great job filming a phenomenal health assistant at Palmcroft, Mary Stewart. So we're going to showcase this video as well.
Hi, my name is Mary Stewart. I'm a health assistant here at Palmcroft Elementary School. I'm part of the health service team for Yuma School District 1. I'm proud to announce that Yuma School District 1 will be offering COVID testing for our students with parent consent. In December and January, the health service team received valuable training by the Yuma County Health Service staff, enabling the health service team to safely and effectively administer rapid COVID testing with the results available in 15 minutes. Rapid testing will be administered at the school by trained members of the health service team. Students will receive a non-invasive nasal swab, and results will be determined in 15 minutes. If the test results is negative, the parents will be asked to pick up their child. As a reminder, if children are sick, they need to stay home until the symptoms subside. If the results are positive for COVID, the parent will be asked to pick up their child and will be provided with additional instructions at that time. Only students with parents' consent form on file may be tested. Please log in to ParentView or contact your school to access the consent form. By signing the consent form, your child would only be tested if they develop COVID symptoms at school or have been identified as a close contact in the past 3 to 5 days. Students, please remember to wash your hands, wear your mask, make sure you wear it properly over your nose, and to keep your 6-foot distance, And don't forget, if you are sick, stay at home.
It tickled a little bit.
Just a little tickle. All right, so for the student testing sites, I know Kim's gonna go over this information, but all of our health, because of the county health being so instrumental in giving us testing kits, enough for the entire district, all of our schools are set up to have this testing at their site, except for Price. So Kim, I'll hand it over to you here.
Well, what has been the beauty of the testing is that when we started with the staff, we thought, okay, we can get them tested, so if they can go back quickly, that's great. On the side of the students, we know that students who are close contact cannot get out of the quarantine. They have to maintain. What was happening before we started testing students was that if we had symptomatic students in a classroom, they'd come to the health room, they'd have a fever, they may have a cough, they may have this. We had to assume, per health department instruction, that every single child that came in with those kind of symptoms were positive for COVID until proven negative. So if we had 3 students, according to our protocols and stuff, we would have to close down the school, or not the school, but the classroom. And so now with the testing, we get, the students come in, and if they have the same symptoms and they're negative, the symptoms have to subside, but they can go back to school the next day if they don't have a fever or so it has made a difference. And the real scenario of this, if a student had symptoms, and many of our families, that student may have like 4, 5, 6 siblings, they have to be considered close contact according to the rules by the public health. So that whole entire family at every one of our schools would have to go home. If they couldn't get tested, they could be out of school for up to 24 days. Now we have this ability, we can test them, and if they don't have a fever, they come on back. If the symptoms get worse and there is a positive case in the family, the parents report that, then we have to go back to our protocols. But this has been a great tool for us, and we can really watch what is really going on in our schools. And one of the things, and I'm about 99% sure that our students are not passing on the virus among themselves. Most of the tests that have come back, actually all of them, have been the adults. And many, many of those that we know of have all come from outside in the home. They went to parties, or they were home and somebody got sick from another work site. But with our protocols of cleaning like we have been, and wearing the mask and the distancing and washing the hands, and our protocols that have set in place, we have healthy buildings. I'm not hearing very much about the flus. This time of year, we'd have tons of kids out. So this has been a great gift to us by the state and by the public health department, giving us all the supplies that we really need.
And I think it's also important, Kim, to share about the drive-up option for parents that have students that may become symptomatic overnight. We don't want them taking them to the health office, so we have a drive-up option offered at Pecan Grove, right?
Oh, yes. When we were first developing the students, we only had like a week turnaround to get this together. And with talking with Christy McCoy and a couple of other people, we wanted to make sure that if MORLS students were sick, not to come in to our health offices or our buildings, just to come in to get tested. So what we provided was the drive-through at Pecan Grove. It's a great site because Sunset Clinic used to be there. We have a drive, it's very nice. And it gave our district's parents the ability to go and get tested. You could, if your child was in MORLS and they were at other schools, they could all get tested there. And if they were negative, back they go. That means that they had the ability to have a safe place to come back to school. They had food, it's really, I think, really made a difference for those particular students.
And then this last slide just shows you the inventory that we have right now. Thank you to the County Health Department. 1,400 test kits available to the district right now in our supply room that we can use from now to the end of the school year. And then the County Health has also given us other opportunities as they have new test kits. They've made them available to us. So they've been phenomenal partners in this whole with this whole project that we have in our district. Anything to add to that, Kim?
All I can say is that this district has been amazing, from the board to almost every employee that cares about our children and our families and the safety of everyone that works in it. So we have really worked very hard, and I think it is making a huge difference. We still continue to work very closely with the public health nurses. We can get our kids back to school. We can get those children back. We have a lot of things in place, and with getting our staff immunized by their choice, we have a fighting chance of getting everybody back 5 days a week at some point.
All right, that concludes our presentation. If the board has any questions for Kim or I, he stands ready to answer.
Kim, the testing kits that the county has provided, has that been provided no cost, or are we having to pay?
At no cost, yes. I go on
Okay.
site. If I need kits, I fill out a form, and then someone from the warehouse goes and picks them up. They've also provided big time supplies of gloves and face shields and masks. And I just ordered enough for every student and every staff member, a new mask to go for when our students do come back. So they have, it's through the emergency government portion of the public health, but they have been extremely great with us.
And so responsive, Mrs. Griffin.
Yeah.
They return our phone calls immediately whenever we have questions about cases or testing or quarantine timelines. With the inventory, they've even offered even more supplies to us that we needed for this project. So they've been so instrumental in this.
While we're on that, this is off the subject, but Luciano, I want to talk to you about an idea that's been floating around in my head about later on down the road, these agencies that have helped us out during this pandemic, perhaps maybe dedicating one meeting to, they're the high five people.
Absolutely, that's a great idea.
But I do have one more question. When we do it, when we are able to get our kids back in school, will this testing continue? It won't stop just because we're back in school. It will continue.
No, we have a plan to continue. Mm-hmm.
Thank you.
Thank you both very much. It was very informative.
Thank you.
I had to throw that out there because I forget. Yeah, thank you, Kim, for everything.
You're welcome. Thank you.
This has been a big part, one of the big changes from last fall. If you remember last fall, one of our main concerns was disruption. And we had two scenarios, one where a teacher would potentially be symptomatic and they would also, or they would be a close contact and they'd go to get tested and they wouldn't get the results for X period of time, sometimes up to 2 weeks, in which case we had to treat them as though they were COVID positive. Well, we see here only about 10% of the people who tested really were. By the same token, we had students who would be symptomatic. We would send them home and we would just request for the parent to take the child to get tested. A lot of times that didn't happen, in which case we had to treat that student as though they had COVID and anybody who was a close contact with them at school that day. So that resulted in I'm certain, closing down classrooms that we did, we wouldn't have had to close down had we been in this spot with the testing available at school. So, we talk about our mitigation plans being preventative and responsive. This particular program with on-site testing for both employees and teachers really dramatically improves our ability to respond and make sure and really reduce potential disruption to learning.
I did have another question. I let it. The consent form, Jamie. A child shows up symptomatic. Do we have that consent form on site, or do we have to wait to get that in?
We encourage people to fill out the consent form,
Before
ahead of time.
any issue?
But upon consulting with our attorney, we can call and have the parent come in, fill out the consent
Okay.
form, and then proceed with the test.
Okay.
Now, devil's advocate, have you called and any parent refused?
Oh, I don't know. Anybody know the answer to that? They have the right to refuse, in which case we have to treat it as though it's a.
Kim?
Yes, I've had like maybe 2 or 3 parents that have said, no, please do not test. But the majority of the parents, the rule I have with all my health assistants is with students, you must call first before administering any test, even if there is a consent form that is signed, and the parents have the ability to sign it through Parent View, and if they don't have it, they just come to our office and have it signed. But our health assistants must call first to make sure that it is okay, whether or not they have a waiver or not signed.
Oh, that's good. Okay, thanks, Kim.
That clears a lot up.
Mm-hmm.
Clarifies it. Thank you, Kim.
Okay, thank you, Kim. Thank you, Luciano. Okay, now, here we go. I'm gonna get up. This is my pointer.
Okay. Is there any way to enlarge it or move the? I can't see a thing.
Well, I don't know that I can enlarge it. Can you enlarge it, Susie?
A little bit.
Or zoom in on one piece that you're gonna show.
Okay, this should be a familiar screen. This is This is the ADHS screen that reflects the school K-12, pre-K-12 data that's updated every 2 weeks on a Thursday, right? So it was updated today. And you can see we have, so our board decided that the 2 metrics that were going to be most closely monitored were the percent positivity and the number of cases per 100,000 residents, okay? And there's 2 zones. There's a yellow zone and a green zone. The yellow zone indicates that the recommendation is to use the hybrid instructional method, where some kids are home, kids who want to be home are home, kids who want to be in school are in school, okay? These recommendations were made last summer, so we need to keep that in mind, or in the fall. We need to keep that in mind. These were made before any vaccine had been developed or tested or made available. These recommendations were also made before reliable testing was readily available with a rapid response. So you can see, you can see the trajectory from January 3rd till today's date. Today's not January 24th.
Right.
Right, today's February 11th, but this reflects data from the week of January 24th. There's a 2-week lag from the time the data is collected till the time it's actually reported on this screen. But you can see in the cases, you can see the downward trend from 885 cases to 736 to 430 to 289. On the percent positivity, again, you can see the trend where we're this week. Today's update was recorded at 17.3%. And again, that reflects the January 24th date. So I don't want to go too fast. Any questions on this page? The CDC is supposed to update. They told us they were going to update some recommendations this week. When that happens, ADE and ADHS said they're going to update some recommendations. I don't know if they'll change these, but again, keep in mind this 10%, for example, was set before widespread testing was available and before vaccination was available. So we have this other site. I'm gonna move my analog. I'm still analog at heart.
I appreciate that.
Yeah.
Did everybody see that? That's February and March. Okay. So what this screen is it's a database that's updated daily, and it's called laboratory testing. And if I give you an example, Susie, can you hit the week of the 24th? Right there, 124. It shows 17%. You guys see? Anyway, 124 shows 17%, and then sure enough, 17% is what was populated today on the school website. Okay. We can see last week's. Can you hit that, Susie? Okay, last week's 11%. So if you look at my analog here, this is today, 17.3%. It reflects this week, right? That's not on here. Next week is going to reflect this week, this first week, okay? Which is 11%. In fact, it's going to be about 11.2%. And it's going to be somewhere around 210 cases per 100,000. Okay, now we have this week, which is going to be reflected on the 25th, and it's our current week. It's trending just below 11% right now. It's trending at about 10.6%. It'll be updated. It'll be, brought up to date through the end of the week and probably finalized somewhere early next week, okay? But it does indicate that the downward trend is continuing. And like with any statistic, the closer you get to 0 and the closer you get to 100%, the curve tends to flatten out, right? When you're in the middle, you can rise or fall pretty steeply, and then when you get towards the top 100% or the 0, things flatten out a little bit. So we anticipate next week, the 18th, being about 11.2% and somewhere around 210. And this week, which will be reported on the 25th, we anticipate somewhere around 10.5 to 11%. And right now there's 52 cases. That's going to be higher, but if there were, you can go up to about 100 cases, about 200 cases, and still be within the 100 per 100,000. So what I really want to say is, in the beginning, our recommendation was within the range, right, within the yellow for 2 consecutive weeks, which means that you're 2 weeks behind, right? So what I want you to consider is, if we continue to use the metrics and we're in the yellow for 1 week, we can get a very accurate picture of what the following week is going to read. So in a situation like this, for example, if this were to come in at an acceptable level, we could look and see what this level is going to be for the next week. In other words, we could say it needs to be within the range for 1 week, and then the next week needs to be also in the range. Because these have been very, very accurate on this screen. By the time the week is finalized, the information has been accurate. The only thing is that on this screen, it's rounded to the nearest whole number. So it could be 11.2, it could be 10.8. Okay, so that's kind of the way that what we understand about the data has changed over time, since this website became active. Any questions about the metrics? So this is the one that I check every day. And sometimes I check it and think, wow, that's way different, and I realize I forgot to hit Yuma County.
Is that a public?
Huh?
Is that a public website?
Yes, yeah, this is it. Arizona Department of Health Services website.
But you do have to remember to hit Yuma County.
Yeah, you can check
I've
any
done
county. You can check any county. So again, even on this one, you can see the downward trajectory. Okay, next I want to talk about vaccinations. You make that any bigger?
I will try, yes.
Well, don't worry, this is coming back. If you hit present,
Sorry, thank you.
I need that
There we
magnified
go.
screensaver, you know?
okay.
Oh, jeez.
I want to thank Christine McCoy for generating this data for us. Also, Christine's the one who took care of all the scheduling of all of our vaccinations. Okay. So, on February 3rd, we had a vaccine clinic. And on that day, we had 55% of our employees receive their first dose.
Is that all employees, Jamie, or just,
This is all employees on the right,
okay?
or on the left, rather. On the left, on the right is just teachers.
Okay, thank
By
you.
percentage.
Oh, it says right there, sorry.
Okay, so on February 11th, all employees will have had 55% who have had the first shot and 11 who will have had their second dose, for a total of 66%. Okay. On March 3rd, we will have had 54% who have had their first dose and 64% who will have had at least one dose.
Okay, I'm confused because I thought once you had your first dose, you had to wait 28 days for your
28
second.
days, right. So this is March 3rd, this is February 3rd.
Okay,
28 days later is March 3rd.
okay. I was, never mind. I
So-
wasn't there.
I want to talk about, or a little bit about, the percentage of people who chose to get vaccinated.
Okay, but I'm confused. You said March 3rd, 54%
Will have had,
will have had the first shot,
no,
the first vaccine.
the second one,
The second one.
on March 3rd.
That-
So here, let me color code this. Green is both doses. Blue is one dose. Yellow is elected not to,
Okay.
to be
Okay.
vaccinated.
So
Okay.
54% on March 3rd received the second dose, 64% received
Either the first or the second, right,
either or.
right.
Thank you.
So let's go over here to classroom teachers. And this is something I want to point out. On February 3rd, when we did our survey and we asked if you either have already had your first dose, wanted to be vaccinated, or did not want to be vaccinated, 40% of the teachers said, I don't want to be vaccinated, I'm not interested. A week later, when we had our second opportunity, that number went down to 33%. So we have people, of the people who are hesitant to become vaccinated right now, they're not necessarily all hard-nosed, right? These are people who are maybe in wait-and-see mode. A lot of these people are young and healthy, maybe they're in their 20s. I don't know if anybody here knows anybody in their 20s, but I have a couple of sons in their 20s.
Yeah.
You know, these are people who feel like, don't need it. So, just to give you an idea here, okay? On February 3rd, this number for the first dose was 60%. 60%. Today, on the 11th, another, let let me see how this goes here. 60% of the people who are interested got their first dose on the first time, and the rest who were interested got their first dose today. Okay, so so what that means is on March 3rd, Christine, help me make sure I'm reading this correctly. March 3rd, I'm gonna go in and get my second dose. 60% of our teachers will get their second dose. And that leaves 6% of our teachers who are gonna have only one dose after March 3rd.
6%.
So if you do the math, if 66% is how many teachers are gonna get their, or 67% is how many teachers are gonna get vaccinated total, after March 3rd, less than 10% of them will not have had their second dose. So less than 10% of them are gonna have their second dose on March 3rd. I mean, on March 11th. So if we look at this, on March 3rd, of the teachers who are opting in to be vaccinated, 90% of them will have received their first dose, or their second dose on March 3rd. The other 10% approximately will receive their second dose on the 11th of March. We give some processing time there.
Can you say number instead of percentage?
I'm sorry,
Number instead of percentage?
I don't have do you have the number, Christine?
Yes, we do have the numbers. I'd have to pull that for you though, but I didn't have them.
Well, we have 420 teachers. 67% of, so 2/3 of 420 want to get, are going to be vaccinated.
I'm just curious about that last percentage on the 11th. What number of teachers are we talking about?
Oh, I can tell you about 24.
Okay.
24, 25.
Spread across campuses.
Across 18 campuses, yes.
Okay.
Well, maybe not across all 18 campuses.
Great, it could be a bunch at one, but,
In the district, yeah.
okay.
So that's teachers only, right?
Teachers only or
This is teachers
everybody?
only.
Got it.
On March 11th, the 6%.
Yeah. As far as everybody, on March 11th, there will be 10% of the total, which is about 100. When you take all the employees combined. But I think it's important to pull out the teachers because those are the ones that are going to be in the classroom with the kids.
Right.
So the vaccination, in my mind, is a game changer. That was one of the things that we talked about a lot in the fall. Was there was a lot of evidence that kids that COVID's not as hard on kids. They don't contract it at nearly as high a level, especially younger kids. But we were worried about the adults, right? And the adults have to run the school. And when the adults have to stay home, and then you don't have then you have a disruption. You don't have enough subs and things like that. So by March 3rd, we're going to have a huge chunk of our teachers that are 90% of the ones that want to be vaccinated will have both doses on March 3rd.
And when you say subs, does this include our subs?
The second group, this group right here, includes subs. The folks who got vaccinated today, we were able to reach out, and every one of our subs and other contracted employees like Menta Group, Desert Choice.
Oh, good.
All those people were able to get in under our umbrella. So any substitute teacher who wants the vaccine was able to get the vaccine today.
Great.
So Matt, the special need group that works with Matt, the counselors and the hearing, they were all, if they're with that mentor group?
They were pretty much in this.
Okay.
And if they're our employee, if they're a District 1 employee, they were in fact, actually, to be honest with you, most of Matt's people got in even before that. Most of the people that work in.
Because they were medical.
Post,
Okay.
Speech therapists too.
Yeah, therapists, psychologists, your physical therapists. They were in this group at the latest. And a pretty significant number of them were able to get in before that and already have their second shot.
Great.
So any questions about the vaccinations? you look at these charts and you're like, oh, that makes complete sense. And you start trying to explain it and you're like, oh, wait a minute, I'm explaining it.
It's that 2 weeks, that 2 week lag, that, that kind of confuses you somewhat, but,
On the data?
Yeah.
And that's what's confusing about it, is, you could, a district could wait until the school webpage gets updated and reflects within the range twice, and that could really be the 4th week.
Right. That's
So,
true.
so they could have been safely back 2 weeks prior to when they were.
So Jamie, on the ones that have gotten their second dose, have you had a lot of them call out for a few days afterwards since it's rougher?
Well, we may or may not have a couple in the room in that category.
I came in an hour late.
Okay.
Wayne's still a little punky. Susie worked from home the next day.
Okay.
And I think most of the time, what I've heard is that it's been it's mostly the next day.
It's mostly one day is what
One
I've
day.
heard as well.
Yeah.
I'm just wondering if we were to decide to go back early, if that would cause a problem if a lot of teachers were not coming in right after
Yeah, I think
the second dose.
on that date, on that March 3rd date, when we're gonna have, gosh, probably 200 and some teachers get their second shot, the potential for disruption the following day could be pretty high.
Yeah.
And that's why I wanted
Friday afternoon.
Well, and that's why I wanted to know about March 11th, not just the percentage, but the number of teachers that we're
Right.
talking about.
Yeah.
And
It's in
in my mind, is that coverable with subs and principals and counselors or whomever at a campus?
Right.
Because to me, that feels manageable.
Yes. Under normal circumstances in a typical year, there might be days where we have a professional development activity that has how many teachers participate, William?
Oh, yes. Yes.
Sometimes we might have a professional development a day where there's a professional development going on, a conference or something like that, or training, where maybe 20, 30, 40 teachers are out,
yes.
50 teachers are out.
At the most.
Yeah.
In fact, it's less, because we try very hard not to put those on, because substitutes are always an issue. So
Right.
if we have 15 teachers out for a PD, we've maxed out the system.
But if you take the 15 and you add the other 10 that are,
Collins.
that called in sick, and the handful that took a personal day, then you're looking at about this many.
Right.
So, some information to consider. Last fall compared to today, okay, the Moderna vaccine is being offered to all different district staff. And I feel like I need to say this. We have worked out with Congressman Dunn, with the county health department, county superintendent, an opportunity for these clinics for all of our people to be vaccinated. Okay, so they've had the opportunity. They've had the opportunity to be vaccinated. At some point, if somebody has an opportunity to have a degree of protection against something, and they choose not to take that opportunity, then they're assuming that level of risk for themselves, right? On-site rapid COVID-19 testing, another big change from last fall that we just did not have available to us. Our MORLS program and our district mitigation strategies when we were in school last fall for the 2 months we were in proved effective. We didn't have examples of COVID being spread at school. Almost every case was someone who was infected outside, over the weekend or at home, and then had to stay out. National studies and data support those findings. Elementary and secondary schools are not a significant source of COVID-19 spread. In fact, much lower than the community at large. And the younger the child, the less the likelihood of transmission. And finally, the benchmarks indicate the community spread is on a rapid downward decline in Yuma County. We're coming down from way high, but we're down, we're getting down to the canopy area. So those are the things to consider. And learning models to consider, 2-day hybrid, 5-day hybrid. The goal needs to be a 5-day hybrid. That needs to be the goal. Whether we transition into from a 2-day into a 5-day, or whether we just say we need to go into the 5-day, we're gonna need to have, kids on campus to take the easy merit for one thing right after spring break. And so whether we choose a short transition of a 2-day and then go into a 5-day, or whether when we go back, we go right into the 5-day, where it's basically a choice: you stay home or you come to school. That's a decision that needs to be made. So now I want to hear from our principals. I want you to hear from our principals.
Can we have a 5-minute?
We can have a 5-minute break. Do we need to recess for 5 minutes? Okay.
Just for 5 minutes.
Ready, break.
Okay,
Thank you.
call it.
Oh.
5-minute recess. See you all at 5:35.
We're gonna have a 5-minute break, returning at 5:35.
New hope.